Welcome. In this short presentation, an epidemiological study of type 2 diabetes in African American adults is conducted in one of the most prevalent states with type 2 diabetes, ranking second highest state within the U.S. with a 12.5% diabetes rate, matched with an obesity rate that also places Mississippi second with a 34.6% rate as of 2012. The message seen here is clear. Like many other chronic diseases without a cure, diabetes can be prevented. The first giant step in battling this epidemic begins with public education and awareness. Now, as our thesis states, the type 2 diabetes epidemic in Mississippi and African American adults is controllable, curable, and preventable through the practice of policies, procedures, and preventative care made accessible by healthcare to the affected population. An important aspect of preventing and controlling this illness is diabetes education. Studies show that Mississippi and African Americans are 10% less likely to receive this essential information. It is important to note that while the state is no longer the worst in the country, it is not because prevalence has decreased. In fact, it only continues to grow, as does the disproportion of cases between the state and the nation as a whole. Now, Mississippi's population as of 2010 was 1,099,400. Of those individuals, there were over 200,000 diagnosed diabetes cases. Even more, over 250,000 people had prediabetes. Devastatingly, diabetes contributed to 2,860 deaths, combined with thousands of people suffering from loss of vision, a high number of amputation and kidney failure. The impact of this epidemic is enormous. Financially, diabetes costs the state and its citizens approximately $1.7 billion to treat. Now, the normal African American citizen is twice as likely to develop diabetes complications in their lifetime versus white individuals. These complications include the loss of lower extremities due to a related condition or complications, and furthermore, kidney failure is also more likely to occur in Black Americans than white Americans, 4 times more likely in fact. Now, data has made it clear with a high rate of obesity and physical inactivity that the risk for diabetes is not going to lessen any time in the near future. Other risk factors include a family history of the disease, smoking, a trend of high triglyceride levels, and lower or good cholesterol levels. Risk also increases as a person ages, which also makes it more difficult to make necessary changes, such as losing weight. Certain ethnicities are at higher risk for this illness, specifically African Americans. Unfortunately, there are no clear answers regarding why certain populations are more likely to develop diabetes, but education and prevention and risk should be provided to these ethnic groups. Now, the Mississippi Department of Health and its diabetes prevention and control programs are making strides in monitoring the prevalence of diabetes in the African American population, especially in areas with higher levels of poverty and lower access to quality care. Through consistent self-reported surveys regarding diagnosis symptoms and risk factors, as well as data collected by a number of independent groups, the investigation of this illness is done through several research methods, including interviews of patients and common trends of those diagnosed, such as location, ethnicity, age, weight, and so on. The collaboration of physicians and medical facilities is also essential by ensuring an accurate number of diagnosed individuals and by being aware of possible symptoms, which provide them a reason to be tested. Physicians also conduct annual, or more frequently if needed, blood sugar and glucose testings for those that are at higher risk, according to the Mississippi State Department of Health. By utilizing the essential services of public health, both existing and new policies are being developed and provisions are being made so that the health-related concern of diabetes is addressed on both a local and broad spectrum. Under current policies, information, training, and community outreach are all made available from partnerships between national and local organizations that provide the community with awareness, education, and the power to overcome diabetes before it has even been diagnosed. Diabetes management, food and diet suggestions, exercise recommendations, seminars, insulin instruction, pediatric diabetes programs, individual and family support, as well as financial assistance are all made available for Mississippians. Where there are growing cases of chronic illnesses, there is always room to grow and expand the policies that currently exist to conform to the needs of the public health. Under this expansion, policies that focus on lifestyle modification through diet, exercise, and prevention actions through community activities. Overall awareness needs to be made to those who are considered a high risk, such as adult African Americans, who are far more likely to have type 2 diabetes due to childhood obesity, genetics, ancestry, and living conditions in Mississippi. Now, the community promotes awareness so that diagnosing diabetes at an early stage, even in children, will raise awareness of the signs and symptoms of diabetes in order to reduce and prevent the onset of chronic diabetes at a later and more developed stage. Helping Hands, for those who have already been diagnosed, works by offering free medical aid for patients who cannot afford medical supplies or medicine due to lack of insurance or due to an insurance policy that does not cover diabetes-related costs, and works with local pharmacies to make sure patients receive proper medicine and supplies. Now, stakeholders and facilitators are chosen because each is their own and to each their own specialty. Together, there is a combined force and wealth of information that can be seen, studied, and advanced through input from individuals on both sides of the table, those who treat and diagnose diabetes, as well as those who currently have diabetes. Collectively, the team can identify areas in which more studies need to be done, what influence does each have on the community and overall fight of diabetes, and finally uses the individual with diabetes as a center point of the study by incorporating the goals, needs, and experiences of the person with diabetes to guide and direct others alike with evidence-based guidelines. In order to assure citizens that the public health system is doing all they can by enforcing policies, insurance companies are mandated to include health insurance coverage for any case of diabetes, regardless of age or duration of illness. Now, Mississippi offers several programs to the public that serves as a link from the public to the health services provided that encompass a wide range of health services made available to the members of society. Through training, certification, and degree programs, the public can rest assured that those who are giving treatment for diabetes are fully educated and qualified to do so by requiring all medical personnel to receive certification through a nationally recognized course prior to treating any patient. Mississippi has made several provisions and regulations that evaluate the diabetes epidemic and how it can be better treated. Again, education and awareness serve as a portal to offsetting the number of known cases of diabetes and the public health system. Has not deferred from this standard by continually conducting screenings, tests, and furthering the advancement of medical treatments through a continued study and evaluation of type 2 diabetes. Now, diabetes is a slow killer with no known cure. However, the complications associated with diabetes can be reduced and treated with awareness and preventable care. Thus, the cornerstone in the prevention of diabetes still remains to be lifestyle change, with medication serving as a conjunctive role. Lifestyle modifications need to be addressed in high-risk individuals like African American adults via informative education. There is evidence that shows diabetes can be prevented or delayed in high-risk populations through lifestyle modifications and pharmaceutical aid. The furthering of conducted studies will support well-informed policies, procedures, and strategies to continually address screenings and treatment of high-risk populations in the real world. Prevention serves as the only chance for change, the only change to lessen the ever-increasing hindrance of type 2 diabetes in Mississippi.